Welcome, everyone. Thank you for being with us today for our webinar. We'll get started in just a moment as our audience filters in. Hi, everyone. Welcome. We'll get started in just a moment. Thank you for being with us today. Well, hi, everyone. Welcome. I am Michael Morella, Managing Editor at U.S. News and World Report. Thanks for being with us for today's webinar, Tapping the Promise of Vaccines while Combating Misinformation and Skepticism. Our experts will discuss the health imperative of ensuring that all children get access to critical vaccinations, especially in light of the fresh challenges presented by the COVID-19 pandemic and misinformation. Now, before we launch into our panel discussion, we have a short video conversation with Dr. Peter Hotez.
Welcome. I'm Liz Whitehead, Managing Editor Events at U.S. News and World Report. I'm joined by Dr. Peter Hotez, Co-Director of the Center for Vaccine Development at Texas Children's Hospital and Dean of the National School of Tropical Medicine at Baylor College of Medicine. Dr. Hotez, thanks so much for taking the time to discuss where we are with the management of the COVID-19 pandemic and other emerging public health threats, as well as how to address these challenges in the face of misinformation and resistance by significant segments of the public. To start off, since the beginning of the pandemic, you've strongly advocated for a global vaccination program to control its spread. Can you explain why this is critical and why it led you to develop a low-cost, patent-free COVID vaccine, Corbavax, with Dr. Maria Elena Battazzi and colleagues?
Well, it's for two reasons. One, the obvious humanitarian need of making certain that everyone in the world has access to the same technologies and vaccinations that people in North America and Europe have. But it's also in our enlightened self-interest, because remember that the Delta variant that caused so much devastation in the US in the last half of last year arose out of an unvaccinated population in India, and Omicron and its subvariants arose out of an under or unvaccinated population on the African continent. So, Mother Nature is telling us that as long as we refuse to vaccinate the world's low and middle income countries, we're going to continue to be buffeted by these new variants and subvariants. And so the only way we're going to end the pandemic, I believe, is to vaccinate our way through it. And that's the rationale behind Corbevax and a related vaccine that we're also helping in the development with in Indonesia. And it's a different type of technology. It's a recombinant protein technology made through microbial fermentation and yeast. And the reason that piece of information is useful is that's the same technology used to produce the recombinant hepatitis B vaccine made all over the world. So countries such as India and Indonesia and Bangladesh and China and Argentina and Brazil, Cuba, they all make their own recombinant protein hepatitis B vaccine. And our reasoning is, if you really want to make a coronavirus vaccine for global health, that's a pretty good technology to use, because you can plug and play into their system. And we've used that approach for our parasitic disease vaccines for diseases such as schistosomiasis and hookworm infection. And we've used it successfully for SARS and now SARS-2, which is COVID-19. And India's furthest along, and that vaccine that we helped in the co-development with Biological E. You did the early prototype here at Texas Children's Hospital, the Center for Vaccine Development, has now gone into 60 million doses have been administered so far. So 37 million kids have gotten their first dose, and more than 20 million have gotten their second dose. And now we're waiting for approval in India as a booster for adults as well as the younger kids, and waiting for approval globally through the World Health Organization. So we're very excited to make that contribution.
What do we know about, or how long, or will it be a while before we know how effective it is against the current variants and its durability over the long term?
Well, we'll have to see. Just like here, India only now is being buffeted by some of the new Omicron subvariants. So hopefully we'll collect that information. We do know that in in the laboratory, the virus neutralizing antibodies against the vaccine do a pretty good job cross neutralizing all the different variants and subvariants. That's one of the advantages of Corbevax, that and the fact that it seems to produce pretty durable, long-lasting virus neutralizing antibodies. And so that suggests to me that not only will it be effective as a standalone vaccine, but maybe a booster for some of the others.
Yeah, is there a possibility Corbevax could be a booster that could be mixed with people who've had Moderna or Pfizer in the future here?
Yeah, it's, I ask myself that question every day, and I'd love to see it happen. But, for quirky reasons, it's hard to know because there's no mRNA vaccines right now in India. Well, there's a locally and indigenously produced one that just came up, but there's no significant number of people get Pfizer and Moderna in India. So we can't do a direct head-to-head comparison to see which would be a more long-lasting, durable booster, Corbevax or another mRNA dose. And in the US, we don't currently have a path for doing that because we don't have US government support and we don't have a US manufacturing partner. So I'd love to do that kind of study, and we've contacted National Institutes of Health to see if they can help cut through some of the red tape to actually address that. And so maybe that will happen.
Let's go into this a little bit further. How critical is it for the US and other nations to develop a global strategy to engage in what's called vaccine diplomacy to confront future public health challenges? You've sort of hinted at some of the problems. If you have poor nations, they can't afford to develop these vaccines on their own without help of people like you. What are they to do?
I think it's a multifold problem. First of all, as we've already said, it's in the enlightened self-interest of the nation to fully vaccinate the world. Otherwise, we're going to continue to see new variants emerge. But also, if you've looked at the current strategy that the U.S. uses for providing COVID-19 vaccines, I don't think it's very effective. One, it came too late before we started donating mRNA doses, and it created a lot of resentment in some ways because they came so late. And what's more, just providing a handout of vaccines, I don't think it's the way to go. I served as U.S. science envoy in the Obama administration to really promote and pioneer this concept of vaccine diplomacy, meaning joint vaccine development between countries. In my case, I was asked to do this with the Middle East and North Africa to help build, because they underachieve in terms of vaccine development. And I think joint cooperation for vaccine development is far more impactful than just donating vaccines, because we're teaching people how to fish. And I think, in a true spirit of scientific cooperation, similar to the way when Albert Sabin first developed the prototype oral polio vaccine strains, it wasn't a handout, it was jointly developed with the Soviets at the height of the Cold War. And the two nations put aside their ideologies to work together to develop a life-saving vaccine, the oral polio vaccine. I think we can still revisit that approach. And I think, unfortunately, in the U.S. State Department and in our U.S. foreign policy, science diplomacy probably is still the biggest underachiever. It has enormous potential to promote goodwill between nations and promote diplomacy, but I think we underutilize that.
Well, it seems that it's going to be increasingly important as we get simultaneous pandemics. I mean, we have monkeypox right now spreading in the US and elsewhere in other countries. First of all, just pausing on monkeypox, how serious of a concern is that right now? Are we doing enough, and what would you like to see happen?
Well, when it comes to monkeypox, the more I think about it and look into it, and the more we learn, the more concerned I get. I think the numbers are continuing to rise. We have about several thousand cases globally. We have 500 known cases in the US, led by California and New York with about 100 cases each. Those numbers are going up. I think it's spreading pretty rapidly among high-risk populations in the US. I think we've got to work hard to get our arms around it. The Biden administration announced in the last few days that they're trying to secure 1.6 million doses of the Bavarian Nordic modified vaccinia ankara vaccine. That's good, but I'm not sure 1.6 million is going to be adequate. We could, some are saying we'll need 2 to 3 times that much to really contain this among high-risk populations. And a lot's at stake because we don't want this to move into the pediatric population. We don't want this to move into the animal population, so it becomes kind of a permanent fixture. So I think there's we're so consumed with COVID, we're not talking as much about monkeypox. And I don't think it'll get as severe as COVID-19, but we still have a lot of work to do. And it's a pretty serious epidemic that we should take very seriously.
When you say the high-risk populations, I assume obviously immunocompromised, but are there particular age groups? Are very young kids?
Well, this virus early on got into the LGBT community, especially men who have sex with men in Europe, and then it spread to those social networks. Not that it's a sexually transmitted virus, but it's spreading among those networks. And so increasingly, we're looking at that vaccine as a form of post-exposure prophylaxis, meaning people who have been exposed to the virus, but also now as a form of pre-exposure prophylaxis to vaccinate that population. And that's going to be very important, I think, because they are at risk, and unfortunately, we don't have enough doses of vaccine to go around yet. So to the Biden administration's credit, they're working to secure additional doses. The projections are they can get to 1.6 million over the next few months. I'm still not convinced that's enough yet. So we're going to need to work harder on that front.
How prepared are we to manage simultaneous pandemics, even if monkeypox doesn't rise to the level of COVID-19? And are there factors which will make it more likely that the world is going to have to deal with more simultaneous pandemics? International travel is much greater now than 50 years ago or 100 years ago. Are there factors like that?
Yeah, I think, we have to recognize that pandemics are as big a threat to our economy and security as anything else, and including potentially conflict and war, and treat it as such. I mean, look at the economic and security devastation to our country and the planet, and look at even to our mental health security as well. We can't underestimate that. So I think this needs to be a bigger priority, and the Biden administration has taken some good steps to put in some good people and some infrastructure. I'm still not convinced it's enough. So for instance, we still, even for COVID-19, we still really have no coherent national plan for vaccinating the country. I mean, I was quite disappointed by the level of discussion at the FDA advisory committee meeting. They talked about doing a booster with possibly a bivalent vaccine with the original lineage and the BA4, BA5 subvariant. But most of us in the scientific community feel by the time that's ready, then BA4, BA5 will already be in the rearview mirror. So what is the real plan? And I think we need to, I don't think the FDA advisory meeting is the right venue for it, because it's basically it reacts to what pharma companies want to put forward. I think it needs to work the other way around. I think the US needs to put forward a recommendation for a strategy and then ask the pharma companies to respond accordingly. And unfortunately, the opposite is happening. So the big question is, if BA4, BA5 is going to be behind us by the time it's ready, what is the plan? And I think there needs to be a two-pronged strategy the US government has to undertake. I think one is looking at possibly beyond the mRNA technology, because I'm not convinced the boosters are as durable as we'd like, and it may be inherent to the mRNA technology. Should we be doing heterologous boosting with another technology, such as the particle technology from Novavax, if they can scale it up to that level? For full disclosure, I have a bit of a conflict of interest in that statement, because I'd like to see Corbevax, our vaccine, looked at as a booster strategy as well. But I think that's the kind of thing that and I've suggested to the White House and to Health and Human Services to convene vaccine experts together to make some recommendations, because what's currently being put out there through the advisory committees is unsatisfactory. So coming up with a plan for how we're going to boost the nation to fight the remainder of this pandemic, that has to be done. At the same time, I think we need to more rapidly advance towards a universal coronavirus vaccine. And I do think that is feasible. We're developing one as well. Others are putting technologies forward. It's going to be a while before that's ready, but we don't really have a coherent interim plan, I think, to deal with this pandemic for the rest of the year.
Are you getting any traction? Obviously, these trying to change government bureaucracy is very difficult, but are you getting any traction in this idea of convening coronavirus vaccine experts together to make these recommendations?
Well, everyone I've spoken to says it's a good idea, but I haven't seen it happen yet. And there may be things going on behind the scenes. I often like to say of the 10 things I suggest to the White House or Health and Human Services, one seems to gain traction, and whether it's in spite of what I said or because of what I said, I'll never know. But we're continuing to try.
So the elephant in the room is what public health experts have been dealing with over the last couple of years in terms of vaccine skepticism, misinformation, outright attacks on public health experts, scientists, researchers. How would you characterize the level of hostility compared to recent decades? And to be fair, I mean, for hundreds of years, doctors, physicians have gotten attacked by people who are afraid or have received misinformation that's misguided them. But how would you characterize what you're seeing now versus, say, 20 or 30 years ago?
Well, as we've discussed before, I've been on the front lines of this for a couple of decades, not only because I'm a vaccine scientist, but by default, I became an expert in vaccine anti-science because I have 4 adult kids, and Rachel, my youngest daughter, has autism and intellectual disabilities. And I wrote a book a few years back called Vaccines Did Not Cause Rachel's Autism, which put me in their crosshairs and has made me public enemy number 1 or 2. And so I've watched how this anti-vaccine movement has evolved and devolved. And 20 years ago, it was primarily around fake links to autism that they were proposing. And unfortunately, over the last 7-8 years, and now amplified in this time of the COVID pandemic, it's become a political movement. It's very much linked to the far right. And you're seeing this come out of the members of the House Freedom Caucus, right, who openly promote anti-vaccine viewpoints. We have 2 senators from Wisconsin and Kentucky, respectively, who openly espouse anti-vaccine views, or in one case even host anti-vaccine meetings. This has caused a lot of damage and undermined our vaccine ecosystem, but it's gotten worse because it's amplified now on Fox News nightly and by the nighttime Fox News anchors and some of the other conservative outlets. And the consequence of this has been a whole segment of the US population has refused to take their COVID vaccines. And so I have a new book I'm writing with the working title Anti-Science Kills that really looks at what happened in 2021. And I estimate 200,000 unvaccinated Americans needlessly lost their lives because they refused a COVID vaccination. And I also emphasize that this is the hardest thing I've ever had to talk about as a physician scientist, because, all of our training, Liz, says as a doctor, as a scientist, hey, you're not supposed to talk about Republicans and Democrats and liberals or conservatives. We're supposed to be beyond all that and be politically neutral. But you can't avoid the actual facts and numbers. And this has been now followed very closely by Charles Gaba, the health analyst, the Kaiser Family Foundation, the New York Times, Axios, National Public Radio, the Pew Research Center, all point to the same thing, that those refusing to get vaccinated in 2021, now into 2022, are overwhelmingly in red states. And the redder the county in the red state as a surrogate measure, Trump voter in the 2020 election, the higher the rate of vaccine refusal and the greater the loss of life. And even so much so that the New York Times calls it red COVID. And so what we're dealing with now is something outside the health sector. This is now a political movement and linked to far-right extremism. And even to the point where you now have the Proud Boys and the Oath Keepers marching at anti-vaccine rallies. And this has been well reported. So it's become part of the far-right authoritarianism in the United States. And the health sector doesn't know what to do. And that is the reality. We have an excellent Surgeon General, Vivek Murthy, and I think the world of him. He's smart, he's earnest, he's hardworking, but they're focusing on the social media companies because the political stuff is too hot to handle. And sure, switching up computer algorithms at Facebook or whatever they're called now, Meta and Twitter is important, but it's not getting to those generating the content, and that's where no one wants to go. And clinging on to this idea of political neutrality, saying we can't talk about it, that in itself is a killer. And so this anti-vaccine activism now in the United States kills more Americans than global terrorism, than nuclear proliferation, and cyber attacks combined. And we refuse to recognize that as the deadly force that it is. And so hopefully the book will have some impact. And I talk about this at great peril, right? Because when Tucker Carlson or Laura Ingraham go after me at night on Fox News, or Governor DeSantis targets me, why he would target a medical school professor from Texas in a different state, who knows? The response, the aggression that I get through social media, through emails, in some cases even physical stalkings, is the army of patriots will come hunt me down. And that's the kind of language that they use. And first I say, I don't know why you need an army of patriots, just me and Ann and Rachel and the cat. Now single patriot will do it, maybe two patriots, but you get the idea. So we're in a very dark time. And now this is spilling over into not only targeting the science, but targeting the scientists. And I worry for the country, because I feel that, we're a nation that's built on science and technologies. One of the reasons we're a great nation is because of our research universities and institutions. And now this is under threat through this far-right authoritarianism.
You've advocated for the formation of a group to protect biomedical scientists. What would you like to see a group like this do? What would be helpful to you? What would be concretely helpful?
Well, the first thing I say is, I'm throwing some ideas out, but I don't really know what to do, to be honest with you. Because again, the health sector doesn't know what to do. This is how do you go up against a political force that's willing to sacrifice the lives of Americans for purposes of control? And that's what the far right is doing. And in the meantime, what I've said is, at least let's protect the scientists. I've in some papers proposed creating something like a defense fund for scientists. I mean, the climate scientists have done this through the Climate Science Defense Fund, or something like a Southern Poverty Law Center equivalent to protect scientists. And I think this may become necessary. And it's not only going to be in the vaccine space. We're seeing it now around COVID origins. I mean, the conspiracy theories around gain of function and claiming that that it was generated by NIH funding research when it's clearly not. I think that's going to be the other big threat that we're going to see. And again, it's not going away by itself. And part of the problem is the scientific and professional societies often don't know what to do with this because, by their charter, by the tradition, they're politically neutral, even the national academies. But what do you, National Academy of Science, National Academy of Medicine, but what do you do, to paraphrase Desmond Tutu or Elie Wiesel, what do you do when neutrality favors the aggressor? And that's what's happening right now. So we really need a fresh look at this and really decide what our priorities are in terms of protecting American values, and which I believe means putting the science and scientists front and center.
Do you have any other final thoughts, any other issues like this that keep you up at night that you think are important to emphasize?
Well, unfortunately, in our discussion today, I didn't give you a lot of good news. I say, we need a more coherent vaccine strategy for COVID-19. We need to better get prepared for monkeypox, and we need to combat anti-science aggression. This is not unique to the United States. I'll say that. The other thing I'm worried about is a lot of these issues are become global now, and that includes anti-science, anti-vaccine activism. We're seeing this extend up to Canada now with the Freedom Convoys to Western Europe. And I believe at some point, this is going to start affecting things that go beyond COVID-19 now that these anti-vaccine groups are well-funded, well-organized, are politically engaged, politically empowered. Assuming that COVID-19 eventually dissipates, they're not going to fold the tent. They're going to start targeting all childhood vaccinations. And we already saw that with the platform of the Texas GOP. And everyone's talking about the anti-gay and anti-abortion language, but in there also is a statement from the Texas GOP that says that all Texans have a, quote, natural and unalienable right not to be vaccinated. And so I think all childhood vaccinations are going to be under threat. So I'm worried about an unraveling of our vaccine infrastructure in the US and globally, and reversing global goals. All that hard work that the Gavi Alliance did to lower deaths from measles and pertussis, Haemophilus influenza type B, to eliminate polio, all of that is under threat right now because of what's happening.
Well, there's no question we're in very unsettling, alarming times right now. I do want to say that your extraordinary work with CorbeVax has resulted in you and your colleague, Dr. Maria Elena Bottazzi, being nominated for the Nobel Peace Prize. And it is one ray of sunshine to know that your exceptional work to try to make people safe around the world is being recognized. I thank you so much for making the time to talk to us today and to share your expertise and insights.
Well, thank you. And thank you for a really interesting discussion today. I hope it makes some impact, and appreciate you and U.S. News and World Report for giving attention to some of these very important issues.
Thank you very much.
Well, our sincere thanks to Dr. Peter Hotez for helping to identify some of the critical issues that our panel of experts will now further explore. Our session today is the latest installment in our special Pediatric Priorities virtual event series, where we explore what children's hospital executives, pediatric providers, community stakeholders, and parents can all do to improve the well-being of America's young people. You can learn more about our programming at usnews.com/pediatricpriorities. I just want to note that we are recording video of today's session, and we'll be making that available on our website after the fact. We're also simulcasting on the US News Facebook, LinkedIn, and YouTube channels. Now, I'm very pleased to introduce our distinguished panelists. With us today are Dr. Julie Boom, Director of the Immunization Project and of Infant and Childhood Immunization for the Center for Vaccine Awareness and Research at Texas Children's Hospital. Dr. Paul Offit, Director of the Vaccine Education Center at Children's Hospital of Philadelphia, and Professor of Vaccinology and of Pediatrics, Perelman School of Medicine, the University of Pennsylvania, and Dr. Sean O'Leary, Professor of Pediatrics at the University of Colorado School of Medicine and Children's Hospital, Colorado, as well as Chair of the American Academy of Pediatrics Committee on Infectious Disease and liaison to the CDC's Advisory Committee on Immunization Practices for the Pediatric Infectious Diseases Society. Welcome to you all, and thanks for being with us today. One final note, if you have questions during our discussion, we invite you to type them into the Q&A in Zoom on your screen. Our moderator will try to give voice to some of those as our time allows. And now to introduce that moderator, I want to turn the mic over to my colleague, Liz Whitehead, Managing Editor with the US News Live Events team. Liz?
Thanks so much, Michael. We're fortunate to have our three experts here to talk about how they and their colleagues are navigating a contentious political climate to continue providing life-saving vaccines, both to get us through the COVID-19 pandemic and to prevent a resurgence of childhood diseases. I'd like to start by asking each of you to give an overview of the programs you direct or participate in and the communities you serve. Julie, can you start us off and talk about Texas Children's?
My pleasure. My name is Dr. Julie Boom, and I'm Director of the Immunization Project at Texas Children's. And Texas Children's Hospital serves Southeast Texas, the entire greater Houston area, and Austin, Texas. And we in the Immunization Project, we do vaccine education for not only staff, but parents and members of our community. And my group also is part of the new Vaccine Surveillance Network, and we do surveillance for vaccine preventable diseases, and we're one of the 7 sites of CDC who perform said surveillance.
Paul, can you talk about your efforts at Children's Hospital of Philadelphia?
Sure. So well, I'm really sort of a basic science researcher that was recruited to actually be a voting member on the ACIP in the late 1990s, early 2000s, when there was sort of the big 1, 2, 3 hit. RotaShield was a vaccine that was taken off the market because of a safety issue for the first time really in almost 50 years that had happened. There was a concern that the measles, mumps, rubella vaccine caused autism, and then there was a concern that thimerosal, this ethyl mercury containing preservative vaccines, could be a cause of neurological problems, all of which were, at least the thimerosal issue and the MMR issue were ill-conceived, but nonetheless, they had an impact, and you sort of saw how that had an impact. So we created, Charlotte Moser and I created in 2000 the so-called Vaccine Education Center, where we create and distribute educational materials. So we have a huge endowment actually that allows us to do that. To try and offer science in a simple, compelling, compassionate, and passionate way to try and convince the convincible that some of these false concerns are indeed false.
Thank you. Dr. Sean O'Leary, can you talk about Children's Colorado and also some of your work with CDC?
Sure, yeah. So at Children's, I'm primarily a researcher. I do what some would call health services research. So my primary area of research is identifying barriers to vaccination and then developing and testing strategies to address those barriers. So that kind of covers a lot of territory. Some of those are logistical barriers, some are financial barriers, and increasingly dealing with sort of attitudinal barriers, vaccine hesitancy specifically. And so some of the work we do, for example, involves community engagement. We have a couple of projects going on right now in rural Colorado to really try and engage local leaders and also to develop messages that resonate within those communities, as opposed to sort of a top-down messaging, more of a grassroots type of a messaging for COVID-19. That's, of course, been quite a challenge. And then the other area I would say I do a lot of is communication. So, Dr. Offit's, I use his website materials all the time. The facts, so the way I think of it is there's the what, those are the facts that we need to know about vaccines to show that, they're safe, they're effective, the benefits greatly outweigh the risks, and that is crucially important. But for a lot of us, particularly pediatricians, family docs, we're having these conversations with families. Oftentimes we find the facts are not enough. So I with colleagues around the country do work and, how do we communicate those facts so that the people who are so the parents, the patients and families who we're having those conversations with, how do those facts resonate with them rather than turning into an argument, which is what happens, fairly frequently, actually. And then, with children specifically through the pandemic, has been doing a lot of outreach to the surrounding communities. I think we are a real beacon for a lot of the primary care providers through the pandemic, providing them a lot of information about the pandemic, about the vaccines, et cetera, in Colorado and surrounding states. So that's kind of a brief summary of what we do. And then in terms of the work with CDC, so ACIP, much of your audience may be aware of this, but basically the FDA, which authorizes vaccines for use in the US, that has VRBPAC, which Dr. Offit is a member of, and that's an external group of experts that advises FDA. And then ACIP is an external group of experts that advises CDC. So I've been part of that group as a liaison for the Pediatric Infectious Diseases Society for several years. And then now I've been representing the American Academy of Pediatrics on the COVID-19 work group. So a lot of the work that's done for ACIP is through the work groups, depending on what the needs are. So for example, COVID-19 work group, we review all the data in a lot of detail throughout. We've reviewed many of the vaccines that have gone through the ACIP and CDC, and then give our summary of our discussions to the voting members of the work group, who then vote on issues that then advises CDC.
Thank you. And as we proceed in the conversation, I do want to drill down on some of these programs that you all are doing that have been very effective, and I'll do that. Julie, we're clearly in another wave of the pandemic. What are you seeing now at Texas Children's re the pediatric vaccination rate for COVID statewide? What trend lines are emerging, and do you still see that the current vaccines are effective in keeping the hospitalization and fatality rates low, despite the high transmissibility of the latest variant?
So over the past 2 weeks, as you know, we've had the vaccine for our 6-month through 4-year-old population for the first time. And unfortunately, despite our ability to distribute this vaccine widely now, we're distributing it not only at all of our hospital campuses, but at all of our Texas Children's pediatric providers. And so Texas Children's has over 60 pediatric practices, and we employ about 350 general pediatricians. And so we've got great ability to give these vaccines. Unfortunately, uptake just hasn't been there. So when you look at the 5 to 11-year-old population, in the first 2 weeks, we gave out about 25,000 vaccines. And if you look at the last 2 weeks, we've only given about 12,000 vaccines out to our 6-month through 4-year-old population. It does concern me that people are, whether they're experiencing it personally or they're hearing it in the news, that these vaccines aren't working as well. It gets some of the variants, and you're going to get sick anyway. So why are you worrying about vaccinating? It does concern me that this may be one of the reasons that parents are choosing not to step up and get their children vaccinated. And I think a lot of people are just simply unaware that we've had over 1,000 children die from COVID. It definitely and especially includes children less than 1, but certainly children throughout 0 to 18 have died from COVID. And really the way I look at pediatric death as a pediatrician is no child should die. No child is supposed to die. So every childhood death is an absolute tragedy, especially now that we have a vaccine that while you may get a flu-like illness, we don't want you to go to the hospital and especially go to the ICU and die. And we know that once you're in the hospital, about 25% of kids with COVID will end up in our ICU. That is a marker of severe life-threatening illness. I just don't think enough people really are aware of the severity of that.
Yes, Sean, can you pick up on this and from your experience in Colorado? A couple issues. Are you also seeing the same low COVID-19 vax rate among demographics? Is it higher among the 16 and up and still lower in the younger kids? And is there, as Julie's suggesting, that there's also, I think, not an understanding of long COVID's risk. for people who are even kids who are infected. I mean, there are other things to be concerned about instead of just hospitalizations and deaths. Can you talk about what Julie's mentioning, that adults don't understand children are still affected? There is a problem with long COVID, and just how are you trying to address that?
Sure. I mean, I can't overemphasize enough what Julie just said. A child's death is a tragedy in a very unique way that touches everyone's lives for the rest of their lives. And to compare the numbers of childhood deaths to the hundreds of thousands, over 1 million deaths in the US in adults really is not a fair comparison. Because when we look at it, for example, there were headlines the other day that during the period of the pandemic, COVID was the number 3 cause of death among adults. If you look at children in the same period, it was actually the number 4 cause of death. And when you look at all of the other leading causes of death in children, it's things like motor vehicle accidents and cancer and drownings, all of these horrible tragedies, right? If we had a simple, safe, effective intervention to get rid of any one of those single things, right, we would jump at it. And here we have that, and unfortunately, a lot of parents aren't taking it due to a lot of the reasons we already know and have talked about. In terms of your question about Colorado specifically, yeah, we're seeing roughly similar numbers to what we're seeing around the country. I think it's still a little too early to say what uptake is going to be like in the 6 months to 4-year-olds with the recent authorization and recommendation for the younger kids. But it's the same issues here as it is everywhere else. Some parents don't feel like it's a threat. All of the information, well, I had COVID, it was mild. Well, yeah, but a lot of people didn't, right? The other thing to point out on that related to that issue is, most children are never hospitalized in their childhood. It's an uncommon thing. A hospitalization for a child is a big deal, even if when they survive, it's not something to be taken lightly. And so we've had thousands of children hospitalized through the pandemic here in Colorado alone due to COVID. And to be able to prevent those, and I can tell you during the Delta wave and subsequently the Omicron wave, almost everyone in the hospital that got into the ICU that was hospitalized for COVID, not sort of coincidentally, but for COVID, was someone who was completely unvaccinated, not a single dose. And so, we know these vaccines work very well. It's really important. The other thing I want to mention is, one of the real difficulties with these vaccines in kids is where are they going to get them, right? And that's what we're seeing in Colorado, is that there are a lot of pediatricians who are stocking them, but there are a lot who aren't. And, remember, pharmacists are pretty comfortable vaccinating adults. They've been doing it for decades. But it's kind of a new paradigm for most pharmacists to vaccinate children, and particularly younger children. And so and in fact, kids under 3, most pharmacies aren't doing that. So where do they go? If their pediatrician isn't stocking it, where are they going to get it? So I think that's also a really very important problem that we need to deal with, is making these vaccines easy to give in primary care settings.
Paul, can you pick up on any of those points, and also this last point about are you seeing pharmacist hesitancy with these lower age groups? And in addition, I'd like to at the end ask you if you could talk about when we need to have a discussion about whether COVID should become part of the mandatory immunization package for school-age children.
Right. Well, what's happening in Philadelphia is certainly what's happening nationwide. It's been hard to watch. We know that a vaccine was available for the 12 to 15-year-olds last May, so it's been more than a year, yet only about 60% of that age group has been vaccinated. We know that a vaccine has been available for the 5 to 11-year-old since last November, so it's been 8 months plus, and still only about 30 to 35% of that age group is vaccinated. I'm sure it's going to be much less for the less than 5-year-old, and has been. The uptake is, where it's been sort of skyrockets, then comes down quickly for those first 2 age groups, has come up actually fairly small as compared to the others for the less than 5-year-old age group. Yeah, I mean, the pharmacists are uncomfortable giving vaccines to the less than 5-year-old child, and many of them make that very clear, actually, in terms of people who are coming there. In terms of mandates, right? So you give me that question. Here's what I would say. I think that I would say, let's see what happens. I mean, you know that this virus, while it can certainly spread throughout the year, cause hospitalization and ICU admission and death throughout the year. So if you look the last 2 winters, that's when you do see more of an increase in hospitalizations and deaths. I mean, at its heart, I still think this coronavirus is very much a winter virus. I'm curious to see what happens this winter, because unlike the previous 2 winters, you probably have 80 to 90% population immunity now from natural infection or immunization or both. And that is protective against serious illness. That is the goal of this vaccine, is to protect against serious illness. So I'd like to see how this plays out. I can say that this virus will be with us for my lifetime, for my children's lifetime, and for their children's lifetime. I have no doubt that's true. This is a short incubation period, mucosal respiratory infection. If the entire world were vaccinated, the virus would still circulate and cause mild disease. It's true with all mucosal infections. It's true with our rotavirus, with the rotavirus vaccine we developed at Children's Hospital of Philadelphia. I mean, that dramatically decreased hospitalizations, but the virus can still circulate in the community. It's true with influenza, and it's going to be true with this virus. So I think moving forward then, who do we need to protect? I think we're going to need to protect the most vulnerable, which is to say the elderly. So now that I'm like over 65, I've reclassified elderly to the elderly, the really old people. I think that group, I think obviously people who are immune compromised, people who have the kind of comorbidities like serious heart disease, serious lung disease, where they can't handle a mild infection. I think because then it's more likely to progress to moderate or severe. I think those are the groups we're going to need to target moving forward. So I don't really see that as a mandate, but we'll see.
One of the other many side effects of the pandemic was that there has been an interruption in childhood vaccines in general, and families keeping up. And I'd like to turn to that, and then also talk about after that what we do about it. Julie, can you talk again about what you're seeing in Texas? Sort of give some idea of the statistics on where you are versus say 3 years ago, with kids being up to date in their vaccinations, and what do you see it improving, in the last half year?
Our state health department has actually looked at vaccine uptake pre-pandemic, during the pandemic, of especially the year 2020, and what's happened since then. And what you will see with this data is that we had a big plummet right at the beginning of the pandemic, that spring break of 2020, March, April, May, a big decrease in children going to their pediatrician and uptake of vaccines. And what we saw happen then in 2021, we went back to our baseline level, but we never did any catch up on those children who were unvaccinated. And unfortunately, if you look now at Texas's kindergarten and middle school vaccination rates, we have a whole new group of children that are delinquent from their vaccines. About the same number of parents are exempting, but a big group that are just simply delinquent. And one of the big concerns has been, well, if we have kindergartners who then aren't vaccinated against important, very contagious diseases like measles, have we created a new little hotbed that if we get an imported case into one of these communities, we've got a big problem. And measles has continued to circulate during the COVID pandemic. If you look at WHO maps of Africa, Afghanistan, we've still had significant amount of measles transmission. So the real worry has been, since we haven't done that catch up for those children, are we just sort of waiting for, you mentioned another pandemic with Dr. Hotez of monkeypox, but could we now see measles? And just to remind everyone, 2019, just before COVID, was one of our biggest measles years that we've seen in 20 years, that even outpaced the Disneyland year. So we were really worried that 2020 measles was going to be the story, and instead, of course, it was COVID-19. But have we just kicked that can down the road? And is that still a possibility? And I think certainly there are areas in Texas that, yes, absolutely, it could be a possibility.
Yeah, I actually like Sean and Paul to talk about the risk of resurgence of measles. Sean, what are you seeing in Colorado? What's being done to track kids who are behind? And are you seeing a difference between urban and rural areas with how up-to-date people are?
Sure. So we've seen similar, I think it's been fairly similar around the country. Big drop, big catch up, not quite back to baseline. And that's what we saw. The best national data we have was from the National Immunization Survey, the kindergarten entry survey that came out several months ago, that showed basically a 1% drop overall in vaccination coverage. Kind of reassuringly, the number of exemptions, so including medical and non-medical, but mostly non-medical exemptions to school entry, had stayed the same. So it hadn't gone up during the pandemic, at least at that point. We are seeing, in terms of attitudes in Colorado around vaccines, we've seen those change. We actually just published a paper where we actually saw an improvement in vaccine attitudes shortly after the onset of the pandemic for about 3 or 4 months, and then a return to baseline of what it was before the pandemic for the fall of 2020. We need to look at the data further on to check and see where those attitudes are now, because attitudes often reflect intentions, which then reflect behaviors with vaccines. So, it's twofold. One is addressing some of the hesitancy issues that may have spilled over from the pandemic. We can talk more about that. And then the other, of course, is just all of those parents who would otherwise vaccinate their children, making sure they're getting into their appointments, et cetera. And there's a lot of work going on in Colorado and nationally to try and bring those kids in who've not been vaccinated. I mean, what Dr. Boom mentioned about measles, it is, essentially the most contagious virus known to humankind. And we think of it as the canary in the coal mine. And the really crucial thing to think about with those the 2019 pandemic or 2019 measles outbreaks was that although we had the most cases since 1992, they were uniformly contained within the communities where they happened. So communities where there were significantly lower vaccination rates than the surrounding communities got seeded with measles. They spread, but they didn't spread all the way around the country for 2 reasons. One, a very effective public health response, and 2, high vaccination rates in the surrounding communities. Now we've got, one, public health stretched very thin right now, responding to the pandemic. A lot of people have left public health. And 2, a dip in our vaccination coverage for measles, so that we are all anticipating we may see more measles cases than we did even in 2019 if we start getting more imported cases here that go to the right places.
Paul, can you pick up on this? How concerned are you about localized measles outbreaks?
Well, as Sean said, I mean, that is the canary in the coal mine. So if there's going to be a problem, that's what you're going to see. I think that, I guess what worries me in this is, and Peter Hotez alluded to this, there's this sort of, the anti-vaccine movement has now sort of linked itself to the right. And the way in which they've linked themselves to the right is not what was sort of previously they were doing, which is vaccines cause autism, diabetes, multiple sclerosis, hyperactivity disorder, et cetera. It's this notion of bodily autonomy. I mean, that's what swung the right to their side. This government off my back, don't tell me what to do, unless you're pregnant, in which case then it's a group of older white men who are responsible for your body. But for the most part, this really links to the right. And as part of that, you can see that there are people, the senators who have made the comment that they think that these vaccine mandates in general are a bad idea, not just for something like COVID, but just in general a bad idea. Do that, eliminate vaccine mandates, and we're going to be right back to where we were. I mean, vaccine mandates were sort of born in many ways in the early 1970s with measles outbreaks that occurred. By implementing those mandates, you virtually eliminated by the year 2000 the most contagious, or one of the most contagious, of the infectious diseases. And that's what worries me. What worries me is this spillover for this kind of, bodily autonomy. Don't tell me what to do. Don't mandate any vaccine, not just this vaccine.
I have a very basic question. Say in Pennsylvania, if a child is behind on their measles vaccination, are they still allowed to go to school? Do they get the exemption?
You would have to ask Sean and Julie that question.
Yeah, so I can pick up on that. So the laws vary a lot by state. So all 50 states allow medical exemptions, as they should. At this point, I think 45 states now allow non-medical exemptions. It used to be for many years only West Virginia and Mississippi did not allow any non-medical exemptions, and recently California, New York, Connecticut, and Maine have joined that group. So I guess that's 44 states. So in the states where non-medical exemptions are allowed, those laws vary a great deal. And basically, in some places, all you have to do is sign a form and your child can go to school if they don't have their vaccines. In other places, you have to document that you've had a conversation with a medical provider or watch an online training session, something like that. Lots of different ways these laws are implemented. And in general, the schools do a very good job of making sure that they're up to date. They work with their state and local health departments to make sure that they are in compliance. And those, for example, in Colorado, we can see all of our school and now childcare centers, we can see the vaccination rates in those schools. We can also see what are the exemption rates in those schools. We can see who's not in compliance, or not individually who's not, but the percentage of people that aren't in compliance. So those, and there are a number of states that have that kind of transparency. And so those laws are very effective. They've maintained for decades very high vaccination coverage. And there's been a lot of talk of this sort of vaccine hesitancy creep from COVID-19 into the routine childhood vaccines. I think that's a very complicated topic, and I think we need good data to understand exactly what's going on there. I think it's actually going in both directions in terms of parents' attitudes. My bigger fear is exactly what Paul alluded to, that some of these long-standing laws that have been so effective at protecting public health, protecting both the children themselves and the surrounding communities, may be under even more attack than they have been. Now, just to be clear, every state just about gets anti-vaccine legislation introduced every year. That's been going on for a long, long time, many years. And those bills almost always uniformly fail. We've had a number of pro-vaccine bills that have passed, but these bills are very difficult to get through the legislature. And so, in fact, in the last legislative year for the state legislatures, all of the anti-vaccine bills failed despite all of this rhetoric. So I'm encouraged by that, but I think we need to continue to educate our legislators on the importance of childhood vaccines, not get them sucked into sort of this my body, my choice business.
Julie?
Yeah, I'd like to tag team onto that. So just even prior to this webinar starting, I got an email that our anti-vaccine group has taken a petition to our governor's office and hand delivered it, that they want to remove all mandates for vaccines. And in fact, there were over 60 different pieces of legislation that were filed during our special sessions that continued after our regular session. And that our regular session started in January of 2021. And so we have another session coming up this coming spring. And we are very concerned that this anti-mandate, which started off with COVID and really started off as an employee issue, has now spread to school mandates, and that they want to take us backwards. And it is very, very concerning in Texas, and we have to be so careful because anything that kind of galvanizes the anti-vaccine movement, and it could be a piece of pro-vaccine legislation, it can just light on fire some of this, my body, my choice mentality. And it is a real problem, and certainly politically motivated where I'm from.
Julie, is Texas Children's and our other hospital leaders being engaged, or are they sort of being kept out of the discussions on these pieces of legislation?
We at Texas Children's, we are working with our nonprofit called the Immunization Partnership. It is a nonprofit in the state of Texas that helps promote vaccines and elimination of vaccine preventable diseases. And we are working to engage every single medical person, be it an administrator, be it a physician, a nurse, to educate, because we then become the voices. We're some of the most important voices for families making medical decisions. And we have to remember that. We have to stay engaged, not listen to some of this anti-vaccine information ourselves and get sucked into it or be afraid of it. But we have to stay out on the forefront. We know doctors and nurses are some of the most trusted people for helping others make medical decisions. So not only for our patients, but even in our personal circles, be it family, friends, people look to us for advice, and we have to remember that and stay out and stay vocal in our communities.
Paul, you're a prolific author, and I recommend to our audience to pull some of your titles, because you've written some of the most insightful works on some of these issues over the last, I don't know, 10 or 15 years. But one book, Deadly Choices: How the Anti-Vaccine Movement Threatens Us All. Since you've written that, how have your perspectives changed, or have your perception of the movement and how it's growing, have they remained the same? And is it at its apex right now?
Well, it's interesting the way it's played. First of all, we've had anti-vaccine activity since the smallpox vaccine, so that's not new. I think in America, the birth of the modern American anti-vaccine movement was in April of 1982 with the airing of something called DPT Vaccine Roulette, which claimed falsely, but nonetheless compellingly, that the whole-cell pertussis or whooping cough vaccine could cause permanent brain damage. And that really caused the anti-vaccine movement to take off. And I mean, and they were embraced by the mainstream media. You had voting members on the ACIP, voting members on FDA's VRBPAC that were anti-vaccine activists in this sort of notion of just bringing everybody together in this kumbaya moment, when therefore this would all melt away, which obviously wasn't true. And it built and built and built. I mean, to the point of, legislation that was sort of being able to capable of moving back these vaccine mandates, until Andrew Wakefield, who was really the best thing ever to happen to public health. I know this may surprise you, but Andrew Wakefield, when he came out in the late 1990s with the notion that MMR vaccine caused autism, it's not just that he was wrong, he was fraudulent and wrong. And eventually, I mean, he became more and more marginalized, so that he's appearing on the Alex Jones show or appearing on conspiracy cruises with other conspiracy theorists. And so with him, I really do think, as the anti-vaccine movement really attached themselves to his star, and his star came crashing down, that they were marginalized. So no longer did mainstream media sort of go to the anti-vaccine activists for the parents' point of view, which was true throughout really the 1980s. I think when he came about, he really marginalized them. That said, obviously they're tremendously powerful because they're very good on social media and getting their message out there on social media. But I think the message was only effective when it changed with COVID, and that surprised me. I would have guessed that when COVID hit, it would only further marginalize the anti-vaccine movement because vaccines were our ticket out of this pandemic. But I was wrong. I mean, what ended up happening was that this sort of embracing by the right of this notion that my body is my choice really gave them an enormous amount of money. Look at Bobby Kennedy Jr.'s group, Children's Health Defense Fund. I mean, that just took off. It's just millions of dollars a year that they hadn't had before because of this embracing by the right. And so it's been hard to watch the way this has played out.
Julie?
Yes, I'd like to tag team on that and talk about the money a little bit more. And so whether it's Bobby Kennedy or it's Bob Sears, who came out with a book and recommended his own alternative and selective vaccination schedule. If you go to these folks' websites, they sell nutritionals and other things and push these on families. In the Texas area, there's a physician up in the northern Houston area, same story. Go to this person's website and they say, we'll test your children to see what vaccines they could or should have. And then you'll see all of these cocktails of infusions and things they can offer you. And this is true for Dr. Mercola and other people who are nationally known names. They've made all kinds of money out of this. So they're really sucking parents in on these inherent feelings: my body, my choice, my child, that's my domain. And then they move you to, well, if that's good for you, then these other things are going to be good for you. And you're really stuffing the pockets of these folks. Not evidence-based medicine at all. And these parents may start off with excellent intentions. They want what's very best for their precious child, as do we as pediatricians. And it moves into this whole money scandal. And I see Paul smiling. And this is what I think most people just don't even realize is behind this anti-vaccine movement. If you go to the anti-vaccine websites, the first thing it will say is donate now. Donate now, donate now. If you go to Children's Hospital Philadelphia, where we clamor to go get our vaccine information, it doesn't first thing say donate now. It says, here's the information you're looking for. And so I really wish people could see the difference between these piece of information.
Yeah, if I could just add to that, 'cause that's exactly right. There's the New York Times did a piece called "The Disinformation Dozen," and if you look at their funding, it invariably does come from the dietary supplement industry. When people say to me, "How can I tell a good website from a bad one?" My first statement is, just don't go to the ones that are selling something.
Yeah, just to add to that, I
Go
mean,
ahead,
yeah, I mean, we don't talk about it much, but it is a multi-billion-dollar industry. There was a law passed in the 90s basically saying that the FDA didn't have oversight over herbal supplements and things like that. And so that industry has really exploded. So they're very, very deep pockets, and they know that people who have questions about vaccines or are anti-vaccine are, a good target audience for their advertisements. And so they are pumping money into a lot of this, as Paul mentioned, Disinformation Dozen, to really, get cash basically. And so one of the things when I talk with families, when I talk with pediatricians about, what do you need, how do you seek out good information? One of the things that I always try to point out is, what's the agenda? What's the agenda of the person where you're getting the information from? Because a lot of times there really is a hidden agenda there. When I recommend vaccines, I mean, I'm a pediatrician, and I think, as a rule, pediatricians go into the specialty to help children, to improve the lives of others, right? We're not going into it to get rich, right? We could have gone into a lot of other things if we wanted to do that. We are doing it because we want to help children. So I have no financial interest in when I recommend vaccines to families or whatever. But a lot of the folks that are sending you their misinformation, disinformation, it's because they have, money as their motivator.
Julie?
Yeah, and Liz, I've even said to families with regard to COVID vaccine, when I am out there recommending this to them, I'll say, I want you to know I have no benefit from recommending this to you, except that I want your child to be healthy. I want your family to be healthy. I've said, I'm going to go home tonight. I'm going to have dinner with my family. And the only difference is I want to know that your family is safe. I won't go home with an extra dime, dollar, nothing. And so sometimes when I've said that to them, they're like, wow, she really is altruistic in recommending this so wholeheartedly. And that's why I'm not speaker for any pharmaceutical companies, because I want to be able to talk about these vaccines, talk about their risks and benefits, and have these honest conversations, and families can know that it's not going to my pocket.
Yeah, I'd like to, in our final segment, I'd like to actually dig down a little bit more what you're talking about, Julie, which is rebuilding trust. And Sean, if I could pick up on something first that you were talking about, is when you're bringing in the pediatricians, what Paul and Julie have been talking about is alarming. You've got this sort of massive dark grift going on that the ordinary pediatrician has to deal with. And are we training doctors in how to deal with vaccine skepticism and misinformation? It's a really sophisticated, complex problem. Can you talk on that a little bit?
Yeah, I mean, Julie and Paul are masters at, educating pediatricians. But I think I'll try and summarize it. So, 20, 30 years ago, there was essentially no vaccine education in medical school and even pediatric residency. It was, vaccine rates were very high. I was basically what I came out of residency training in the late 90s understanding was, vaccines are the greatest thing since sliced bread. They've saved millions of lives. And I didn't really know a lot about, the ingredients in vaccines, et cetera, because everyone accepted vaccines and there generally weren't that many questions. I got into practice in late 90s, early 2000s, and started encountering, sure enough, some parents have some questions about vaccines. Most of them I could answer as I was sort of learning on the job, with no small help from Dr. Offit's website and other places like the AAP and CDC and places like that. But as time has gone on, we've recognized that need to develop vaccine education curriculums, both for medical students and for residents as well. There are, I think, it's improving, but it's not where we need to be by any means. I mean, there's a lot of, medical knowledge has exploded really in the recent decades, So no longer can everyone know everything about everything about everything. There's certain things that the medical schools have to decide, what are we going to include in the curriculum? And so it is difficult to add things to those curricula, but we're working hard to get that done. There's a great set of modules called Cover, which is out of Children's Mercy that the Pediatric Infectious Diseases Society promotes, as well as other groups. That is a very good training program, but the problem is it takes time. So it's hard to get that kind of a curriculum into medical schools, into residents, and make it as a requirement. So yeah, it's a complex issue. We've also talked about the importance of not just vaccine education, but science education, how to distinguish science in K through 12, because that's also really important. Getting people to understand, how do you decipher through all the misinformation, the disinformation, et cetera. That's really important as well.
Julie, you also co-authored an important book, Vaccine Preventable Disease, A Forgotten Story, that I think has had a profound influence on you in understanding how to sort of viscerally connect with parents. Can you talk a little bit about what you try to do in that book and how the power of storytelling is used at Texas Children's to try to reach parents?
Absolutely. We branched out to try a different form of education. Many of you may know Jenny McCarthy, and she came out telling stories about her son, who she believed got a vaccine and then had autism. And we knew that there was a whole other piece to this, families who had vaccine preventable diseases like influenza, like rotavirus, and these families had experienced harm. And so we actually gathered up a bunch of stories. We've done this on influenza, HPV. We've created videos that are all over YouTube. You just look up facing meningitis, facing influenza, and it tells the story. And we knew that sometimes some families don't want to hear from doctors anymore. They're like, yeah. I know what the doctor's going to tell me. But hearing stories from other people like them, who, if this person's like their neighbor, someone that they might experience in a faith-based class that they're part of, wanted to then allow these families to tell their own stories. So these stories are told from their perspective, so that people can share. And I will tell you, while some people want facts, this storytelling is another thing to offer. And so often how I'll even use the material is in an office setting. I'll talk about the facts and the science. And when that doesn't persuade or motivate, I'll move towards my own personal story. And whether that's my family or that's a clinic experience, a HIPAA compliant story that I can share, or I will hand them one of our books, our materials, and say, I want you to take this home. I need for you to read this. And even if they just read one or two stories, say about a vaccine they're concerned about, be it HPV or influenza, I hope that that's what gets them over the edge.
Yeah, I would actually strongly urge people in the audience to get a hold of your Texas Children's YouTube videos. They are extremely powerful. I was absolutely blown away. Paul, we talked about building trust in the community, and CHOP has done some really great programs to reach out to certain communities that have been vaccine hesitant. Can you talk about a couple of those?
Well, I think at least in Philadelphia, to me, my hero, in addition, obviously, to the two people on this panel who are also my hero, but the question is, how do you build trust? And I give credit for Vivek Murthy to doing everything he can sort of at the federal level, but I don't think in the end this is going to have to happen at the federal level or the state level, or even the local level. I think it has to happen at the really local level. So to me, the perfect example is somebody like Dr. Ayla Stanford, who's a pediatric surgeon at Temple, who formed something called the Black Doctors COVID Coalition. And what she did then was she gathered like-minded physicians like her, went into North Philadelphia, primarily African-American community, and vaccinated 50,000 people. I mean, and she did it by sort of, sitting in their living rooms and doing the best she could to try and explain why it was important to get vaccinated. And if they didn't get vaccinated then she would come back again. Because I think one of the primary problems here is that most people don't have a primary care physician. And so she sort of, in a sense, provided that, at least regarding this one specific issue, and I think it's a model for how to do it. Is it has to be local, it has to be somebody people can identify with and trust, and that's much harder to do. but I think it's doable. I think at some level we've kind of given up on the unvaccinated, and I think that's a mistake.
So in just the last couple of minutes, I'd just like a quick final thought from all of you. I know that, Sean, you've been concerned about support of the public health infrastructure. Do you want to talk about that?
Sure. Yeah, I mean, one of the things that is a real challenge in vaccines and public health in general is that when we do our jobs really, really well, nothing happens, right? No one's running up to me and giving me a hug because their child didn't die of meningitis, right? It's this thing that we've had to work on for decades and decades and decades to really achieve a lot of the public health successes we've seen in the US and around the world, including vaccines. With public health at this point, I think, these are very dedicated individuals that choose to go into public health. They're doing it for the betterment of their communities and their country. And, it has been really heartbreaking to see some of the attacks that have been happening among people that are really just trying to make the world a better place. And so I do think, there's been a lot of discussion over the pandemic about this concept of, we get a huge influx of funding into public health when we have a crisis, right? But and then it dissipates over the subsequent years. And the concern, in these coming years is that the same thing will happen with the pandemic, particularly with a lot of the real tragedy of what happened with this pandemic becoming politicized in the US. It didn't have to happen that way, and now it has. And so there's this huge segment of the population who has really lost trust in public health, where really they are looking out for the best interests of everyone, no matter what your political views are.
Julie?
Yeah, I think that public health has certainly been very stretched. I can tell you locally, because of the pandemic, some of these folks were working 24/7 for our city health department. Those individuals have just simply quit. They were overstressed. The job was too much. They were part of our retirement pandemic problem. And so it's really been an issue to have the public health authorities and to keep them even just fully staffed. So that's been one of my greatest concerns, is just moving forward, is the rate of burnout that we've had amongst public health. Should we add another pandemic to that, like measles, like monkeypox? Do we have the existing infrastructure just to continue routine business, given what's happened?
Paul?
Yeah, I think I guess one final thought is that like Peter Hotez sort of alluded to this, the fact that he is a target, and he laments being a target. But I think if you just do science, if you, like I, did what, just sort of inoculate mice in a windowless concrete block room at the Wistar Institute, I'm safe. When I go and present at like double-stranded RNA meetings, I don't feel threatened. But I think the minute that, I write a book like Autism's False Prophets or Deadly Choices, or stand up, I think, for science by specifically taking on anti-vaccine activists, you now have crossed the line from science to politics. And politics is ugly and personal and mean. And if you don't want that, then don't do it. There's just no way around that. I think, I don't know if you heard Adam Kinziger's staff put together sort of the phone calls that he'd gotten recently, but it's brutal. What has he done? What is Adam Kinziger's crime? He's just trying to stand up for democracy. So I think it's just, welcome to the NFL. If you don't want to get hit, don't play. And I think that's the way it works.
Paul, you mentioned resistance to vaccines going back to smallpox. And as we close, I've been reminded of a slice of medical history that resonates through the conversations we've been having today. I guess roughly 300 years ago, there was a smallpox outbreak in Boston, which I'm sure you all well know. As the contagion spread through the city, so did fear. And one doctor, Zabdiel Boylston, learned about the practice of smallpox inoculation, which was practiced in parts of Africa with some success, and he agreed to try it in Boston. It was risky, but people were dying. The inoculations proved remarkably effective in lowering the death rate of Bostonians who were inoculated compared to those who weren't. But Boylston's efforts were hugely controversial and led to ferocious personal attacks being made on him and his family. Yet still, he persevered. And that is something that is striking about all the experts you and everybody in the audience and I have heard from today. You all represent an unbroken line of vaccine researchers, scientists, and doctors through history who've been so dedicated to their mission to protect people, to protect us from debilitating and even fatal infectious diseases that even in the face of a doubting, often hostile public, they just keep on going. Lucky us. Doctors Julie Boom, Paul Offit, and Sean O'Leary, thank you so much for sharing your expertise and perspectives today.
Thank you.